In assessing the pelvis for misalignment, again, we're going to palpate the sacroiliac joints in the sacrum to see how those joints are moving, how the sacrum is positioned. And the way that we do that, again, we found the top of the hips before. It's usually around the line of the belt, easy to find. And we're going to work our way in. So there's usually these two kind of nodules or bumps that are usually landmarks. On most people are easy to find. And that's that joint where the sacrum is meeting those ilium. So we get in there, and we're basically just going to put some pressure side to side to see if there's equal fluidity or equal motion from one side to the other. And they're going to work a little bit more midline from there, and that's the sacral bone. And we're just feeling kind of down the triangular space there to see if one side feels like it's sticking up more than the other. We can then get in there and give it a little push one side to the other, and just to feel if one side doesn't want to move as nicely, shift like the other one does. From here, we're also going to come down here to the feet of the patient, and we're going to do a leg length check. What this test does is it's going to tell us if there's been an imbalance on the pelvis, the ilium, one side to the other. So what we do is we're actually just going to give the legs a little pull. We stretch them out to see if one leg is shorter than the other. So for instance, the right side here is a little shorter than his left. What we do is then bring it up to see if it balances out. As it comes even, then that tells me that we have what we call an inferiority on this right side. If it didn't balance out, if it didn't balance out, if it stayed short, then chances are we have a superiority on the opposite side. So we take that information into consideration, and as we go into approach the adjustment, we bear those things in mind, and that's how we work to find the misalignment to then head for the correction.